Okay, so I'm going to now show you how to do a quadruped pelvic tilt. And this is a dissociation style of pelvic tilting, meaning we're going to separate the movement of the hips from the upper body. Basically, in simple terms, what I'm trying to accomplish is that can you move your pelvis forward and back while keeping your back, meaning your mid and upper back, silent as possible? And the reason this is important is that a lot of people that have low back pain tend to have a lot of guarding in the hip area. So it's a very nice and effective way to reduce the guarding, create motion in the pelvic area without getting help from the upper body, because a lot of people with low back pain, they tend to use their upper back to create that motion in their pelvis. And when one is able to dissociate those movements, then they would have better control at moving overall. And this helps with their low back pain. So let's get started. So you're going to start in the quadruped position, meaning with on your hands and knees like this. Now, what I want is your hands under your shoulders and your knees under your hips. So I don't want your knees out here, or I don't want them so close that you're almost like crammed in the middle. So nicely under your hips, and you want your knees to be hip width apart. So from this position, if you look at me, my knees are hip width apart. They're not closed and they're not super wide. So that's very important. The other thing is getting on your hands and knees. You want your wrists to be under your shoulders. Now, there are some people that have, they get uncomfortable around their wrists when they're in this position. Now, the best thing to do, you can either, if you have dumbbells at home, you can put 2 dumbbells and hold them in this position, or you can make a fist like this. So the dumbbells, having the dumbbells in your hand, if you can imagine I had dumbbells in my hand, I can hold them like this, just to create comfort. Now, once you're in that comfortable position, whatever that is, we're going to start doing the exercise. Now, like I mentioned, the movement comes from the hip only and only. You should see no movement in my upper back. And I'm going to demonstrate that for you, and then I'm going to break it down. So from this position, I'm going to tilt my pelvis back slowly. And if you notice, as I tilt my pelvis back, look what happens in my lower back, the small of my back. As I tilt my pelvis back, that area flattens first, and the more I go, it starts to round. But if you look at my upper back, there's no movement whatsoever. What do I mean? Meaning when I tilt my pelvis back, I'm not rounding my back as a cat camel or cat cow. I'm not even quite sure what it is anymore. So I am not doing this. It's similar to this, but there's no upper back movement. So again, from a neutral position, you're going to tilt your pelvis all the way back as possibly you can. Now, once you get to a point, you'll find that there's nowhere to go and you find it difficult. That's okay. Stay there, look at yourself in the mirror, and try to see if you can do a bit more. Now, what I like to do and what I've noticed is that when I match this with my breathing, I'm able to go a bit more. So what I usually do, I do an inhale through the nose, and as I exhale, slowly I start to move a bit more. So this is what I do. And then I'll see if I can do it again. And that is as far as I can go. So if you look at my lower back, you'll see it's kind of rounded and is in a nice C shape. It's not flat and straight. Now, from this position, then I'm going to go the other way. So I'm going to inhale, or you don't have to add your breathing to it. I just like to add breathing into it. And if you notice, I'm going to push my pelvis back like this way, and the top of my pelvis is going to come forward, and it's going to cause arching in my back like that. So again, moving for my pelvis without moving my upper back and rounding my lower back until I get a nice curvature without moving my upper body. Then I'm going to relax and then arch my lower back by tilting my pelvis forward and arching my back as much as I can. Now, when I move my when I move my hips, as you see, there's no movement in my upper body, but a lot of people do this. If they want to round their lower back and tilt their pelvis back, they tend to use a lot of back movement like this. And it's no fault of their own. It's just that when their pelvis is tight, that motion has to come from somewhere. So the body will extract that mainly from the upper spine and upper body. And that is very, very normal. Not normal, I mean, it's naturally because you have to move. But when I start teaching people how to open their hips and kind of dissociate, then they have to slow it down. Slow the movement down, and try to get that movement in the hips. Now, it's okay if you're not going to get it right the first time. Nobody expects that, and it's not even possible. But what I do expect is for you to spend time with yourself, look at yourself in the mirror, and move slowly. Match your breath. Usually I like to inhale first and then move with my exhale, because it allows my body to relax and I can move much easier that way. I have much more control. Now, I'm going to show you the common mistakes I see. So when people are in this position, like I said, if they want to round their lower back, they will use movement from the back. Or I see this. Patients try to round their back and they're like, oh, I can't go. And then when I say go again, they drop like this suddenly, like they suddenly drop their movement. You shouldn't be doing sudden jerky movements, because that could cause a lot of spasm around the low back and induce more guarding. And so when there's more guarding, there's going to be less movement or even pain. And when that happens, it kind of scares the individual. Plus, they won't even be able to get the movement down because the body is guarded. So very important to move gently through the position. If you feel you can't do it anymore, that's okay. Gently go back to neutral again. And always listen to your body. At the beginning, you might not have a big range or able to round the lower back or arch the lower back and create a dip like this. That is okay. Work within what you have and move within that range, a pain-free range. And once you do that, the body realizes there's nothing wrong, and the guarding will come down and the range of motion will increase. But you have to be patient. It's not an overnight success. Some people can do it within a few reps. Some people need a few more days or a few more rounds of practice to get it. Okay, so that's one common mistake. Another common mistake I see is that when I tell people to arch their back, so that means tilting their pelvis forward, they drop like this. So they use their upper body. So even if they can't go down, so if you can see, I'm going to go down, arch my back a little bit. So to get movement, they do this. That again is coming from the upper body. So upper body has to be completely neutral. Again, you're going to tilt your pelvis back and around the lower back, and then tilt your pelvis forward and arch the back as much as possible within a pain-free range. And you're going to do this nice, slowly and controlled, and then go the other way. And that is it. Very simple, but you'd be surprised how many people with low back pain struggle with this. So please take your time with this. No rush, no forcing. And yeah, if you have any comments, let me know at the bottom. I will be happy to answer any of your questions. All right, take care. Bye.